Corticosteroids or steroids are groups of drugs that are used in medical setup in situations of inflammation, such as in pneumonia, asthma, and rheumatoid arthritis. It has both cortisol and aldosterone effect. Now, girls or ladies from eastern and northern Kenya, such as uses this drug to benefit from its effect in higher doses. Dexamethasone injection is the commonly used uh, steroid that is used by these ladies to benefit from this. Now, the general side effect of corticosteroids are driven from the 15 letters of corticosteroids. The first C stands for Cushingoid features, O for osteoporosis, R for the distribution of fat, T for thinning of skin, I for infection, C for cataracts, O for osteonecrosis of femoral neck, S for stress ulcer, T for telangiectasia, E for euphoria, stroke psychosis, R for retarded growth, O for low potassium or hypokalemia, I for increased blood pressure, D for diabetes, S for suppression of ACTH or adrenal corticotrophic hormone. We'll be looking at the general side effects and also the intended effects by these ladies. They can present with Cushingoid features like moon face. The moon face is a roundish face as compared to the normal face or the face resembling the moon. The second feature is the buffalo hump. This is the dorsocervical fat pod as a result of deposition of fats. Osteoporosis is a bone weakening condition as a result of certain disease or drug, which increases the osteoclastic activity, leading to what we call pathological fracture, meaning that the bone is too weak and can break easily. The desired effect by the ladies is this redistribution of fats, leading to what we call lipodystrophy, causing obesity. A BMI of above 30 meters square per kg is what they desire. To their expectation is increase in weight, but other effects are later on seen. One of the common effects seen is thinning of skin, that is easy bruising, as you can see in this picture. There is bruises that is easily seen on the skin on a pitch. Just a simple pitch and they have these bruises. The same valid reason that it is not easy to stitch once they have cut. To stitch these people is really hard because of the thinning of the skin. Or even obstetric procedures such as cesarean section, the C-section is really hard to stitch because of the effect. Remember, the lowered immunity is the cortisol effect. And lowered immunity means the lowered white blood cells, meaning that the microorganism have chance to invade the healthy cells because the immune cells have been lowered. Now, this leads to an infection. Cataract is clouding of the normally clear lens of the eyes. Now, osteonecrosis of femoral neck is whereby there is hindered blood supply to the femoral neck, leading to what we call avascular necrosis that results to fracture neck of femur, a serious fracture. Stress ulcer is multiple superficial erosion in fundus and the body of the stomach. It is the result as a result of the parietal cell excreting the acids into the stomach through the proton pump. Telangiectasia is dilatation of the small capillaries causing a red flat marks on the skin. I'm sure that you have seen what we have on this picture. Euphoria is extreme excitement, or rather a feeling or a state of intense excitement and happiness. This is the long-term effect of corticosteroid. Retarded growth is through the suppression of the growth hormone. This is seen on laboratory rats, not proven on real human. Lower potassium level is as a result of the aldosterone effect. Remember, aldosterone lowers potassium but raises the sodium level through retention. So effects are seen: muscle cramps, weakness, fatigue, paralysis. Potassium is one of the useful ions which is used in the transmission of nervous impulses through the gap junction. Now, retention of sodium causes what we call hypernatremia that draws water from the neighboring cells, leading to what we call peripheral resistance. It is now this peripheral resistance that increases the blood pressure, leading to increased blood pressure. Corticosteroid causes insulin resistance. Insulin resistance means that there are no more glucose entering the cells for utilization. This leads to increased sugar levels, leading to diabetes mellitus. Suppression of adrenal corticotrophic hormone leads to what we call adrenal crisis, and this is a serious life-threatening emergency that is as a result of drastic reduce in aldosterone and cortisol. Now, it is opposite of what we are seeing here as the effect. So it is refractory to also IV fluids and also the vasopressors. Other side effects increase in androgen that leads to amenorrhea and hirsutism. The other one is thinning of air, causing what we call alopecia areata. And the last one is truncal obesity, what we call central obesity and peripheral wastage. We will be seeing them on the pictures. Amenorrhea is the absence of menstrual flow because of increased androgen, which antagonizes the effect of estrogen, which is important in the process of menstrual cycle. Now, this leads to infertility. That's why these ladies using these drugs can't conceive. In male, it causes impotence as opposed to amenorrhea. Hirsutism is overgrowth of the facial hair. This makes female to resemble male in this nature. It is as a result of increased androgen that gives this. I'm pretty sure that you have come across these ladies looking like this. Alopecia areata is loss of hair as a result of the thinning of the hair. Now, the picture you are seeing is the summary of the whole outlook of the effect that corticosteroid have on a human. What I have not mentioned is the central obesity and the peripheral wasting, as you can see on the picture. So I've summarized it, and you can see all the features here. Make sure you subscribe to my channel. You support. I will be posting more videos pertaining the medical conditions and also pharmacology and other series. Thank you.